Operation steps. Before the test. Wash and dry hands. Open the package of SARS-CoV-2 antigen rapid test kits for self-testing. Take 1 test card, 1 disposable sterile swab, 1 sample treatment solution, operation card, and instructions for use. Read the instruction for use and operation card carefully before testing. Operating the test. Take out test card from outer package. Place test card flat on the table. Remove cover layer of adhesive. Take out swab from stick end. The nasal swab head should be entirely inserted into the nasal cavity, about 2 to 3 centimeters, and gently rotated 5 times. Specimens should be taken in the same way in another nasal cavity to ensure the collection of enough specimens. Insert the swab into well A from the bottom of well B. Keep the card flat on table. Add 6 drops of the sample treatment solution to well A. Rotate the swab for 2 rounds, each direction in the buffer. Fold the left side over. Fit 2 sides together completely. Start timing. Wait for the appearance of purple-red line. Test results should be read within 15 to 20 minutes. Next, check your results. Read the interpretation of the test results on the operation test card and check your results. Positive result. A purple-red band appears in the control line and test line. The bottom line can be very faint. Any pink-purple line visible also indicates a positive result. Negative result. Only the control line shows a purple-red band. No purple-red band appears on the test line. Invalid result. If no purple-red band appears in control line or a blue band appears in the control line, it indicates that the operation process is incorrect or the test paper has been damaged. After test, put the test card, swab, and sample treatment solution bottle into outer package and seal it tightly. Dispose the bag in medical waste container according to local laws and regulations.